Welcome to Module 1, Feeding Infants and Toddlers in Early Childhood Settings. This module focuses on promoting breastfeeding, family-style dining, and good nutrition for infants and toddlers in child care. The module is divided into two sections, Feeding Infants and Feeding Toddlers. You are presently in the Feeding Infants section, which will be about 1/2 hour in length. To finish the entire module, you will need to complete the Feeding Toddler session at a later time. The content of this module is based on the third edition of Caring for Our Children, which is a definitive source on best practice in health and safety in early child care and education settings. Links to the standards used in the development of the content in this training session are available on the nutrition module page of the Building a Healthy Start website at www.adph.org/healthystart. All of the Caring for Our Children standards are available online at www.nrckids.org. Best practice in childcare is based on standards, guidelines, and recommendations. It is important that you understand the difference between these terms as you seek to incorporate the information that you receive today into your daily practice. A standard is a statement that defines a goal of practice. It is usually based on scientific evidence. It is stronger than a recommendation or a guideline, but differs from a regulation because compliance is not necessarily required for legal operation. Examples of national standards include Caring for Our Children and the ASTM International Standards for Product Safety, such as their crib safety standards. A guideline is a statement of advice or instruction. A guideline is issued from an organization with acknowledged professional standing and usually comes from a perceived need for such guidance. One example of guidelines is the Choose My Plate campaign from the United States Department of Agriculture, also known as the USDA. A regulation, however, is a standard or guideline that becomes a requirement for legal operation. A regulation comes from an agency with governmental or official authority and is accompanied by enforcement activity. Examples of regulations include the Alabama Department of Human Resources licensing standards and the USDA's Child and Adult Care Food Program meal service requirements. Please remember that the content of this module is based on the best practice standards published in Caring for Our Children. These standards may or may not have been adopted as regulations in Alabama. Caregivers should be familiar with state and local child care regulations and operate in compliance with such regulations. Before we begin talking about feeding infants, let's briefly review the importance of nutrition in early care. Food provides the energy and nutrients needed by infants and toddlers during this critical period of growth and development. As a caregiver, you need to provide food each day to meet each child's nutritional needs. The food you provide should be clean, safe, and developmentally appropriate, and it should look and taste good. As a caregiver, you have the opportunity to observe children's eating patterns in a relaxed and pleasant eating environment. You can then partner with parents to promote the development of healthy eating habits in their children. So let's begin learning about best practice related to feeding infants. Without a doubt, breastfeeding is best for infants. Human milk has many benefits. Human milk helps fight infection. It contains antibodies from the mother to help protect the infant from some illnesses and conditions. Human milk also promotes digestion. The major ingredients are sugar or lactose, easily digestible protein or whey and casein, and fat, which are all properly balanced. It also contains vitamins, minerals, and enzymes that aid digestion and absorption of nutrients. Commercial formulas are a good imitation of human milk, but do not contain enzymes, antibodies, and similar beneficial ingredients. Human milk is less expensive and often more convenient than formula. There are no bottles to mix and clean. Human milk is the perfect temperature, it is always fresh and available, and it is free of bacteria. Human milk helps prevent childhood obesity, as indicated by many studies. Breastfeeding also lowers the mother's risk of diabetes, breast cancer, and heart disease. Breastfeeding also promotes nurturing and bonding with direct skin-to-skin contact, and it is soothing for both infant and mother. An important way to promote breastfeeding in early childhood settings is to provide a comfortable environment for mothers to breastfeed or to express milk. A comfortable environment ensures that privacy is available, but allows socialization with other mothers if desired. Additionally, a comfortable chair and a small blanket to cover the infant should be available. Be sure to launder the blanket between uses. Many mothers will express milk at home or at work so that their infants can be fed human milk by bottle. Another way to promote breastfeeding is to provide a private area with an electrical outlet where mothers can express their human milk. This area should not be a bathroom because of sanitation issues. Think about the environment for breastfeeding mothers in your program. What changes will help to make it a more comfortable environment for your mothers? Remember, providing a comfortable environment for breastfeeding during the day or a place to express milk truly demonstrates to mothers your belief in the importance of breastfeeding. Mothers will be instructed in breastfeeding techniques before leaving the hospital with their newborn. These instructions generally include how to pump and store human milk for bottle feeding later. The Special Supplemental Nutrition Program for Women, Infants, and Children, generally known as WIC, and other organizations can offer support and counsel to new mothers on how to express and store human milk. Commercial breast pumps may be purchased by the family or may be provided by WIC or other community resources. When mothers bring their expressed human milk to child care for later feeding, the milk should arrive in prepared bottles. Mothers may freeze their milk at home in plastic milk storage bags, but should thaw the milk and put it into prepared bottles at home. The bottles should be clean and sanitized. The mother should use plastic bottles labeled BPA-free or with number 1, number 2, number 4, or number 5 on them. Plastic bottles are preferable to glass bottles because they are lighter weight and safer if dropped. Each prepared bottle must be clearly labeled with the infant's full name and the date that the milk was expressed. If the human milk was previously frozen, the label should also indicate the date the milk was thawed. Train the family to use labels that do not come off easily with water or during handling. Labels should be printed with ink that will not smudge or wash off easily. As a safeguard, parents may also write their child's name directly on the plastic bottle with a permanent marker. This practice will identify the bottle in case the label comes off. Human milk may not be frozen indefinitely. You should check the date on the label. Fresh human milk will keep up to 5 days if properly refrigerated. However, previously frozen milk must be used within 24 hours of thawing. Parents may store frozen human milk at home in single-use plastic milk storage bags clearly labeled with the infant's full name and the date the milk was expressed. Expressed human milk can be frozen for up to 6 months in the freezer compartment of a refrigerator with separate doors and up to 12 months in a standalone freezer such as a chest or upright model. Frozen human milk should be thawed overnight in the home refrigerator and put in clean, sanitized bottles the following morning with appropriate labeling. It is important to note that once thawed, human milk should never be refrozen. Discard human milk that appears as if it may be contaminated, perhaps by an unsanitary bottle, or if it's curdled, smells rotten, or has not been properly stored or refrigerated. All bottles should be returned to the parent at the end of each child care day. A parent may use formula instead of or in addition to human milk. Commercial formulas are a good imitation of human milk, but do not contain enzymes, antibodies, or other beneficial ingredients found in human milk. An infant may need special formula, such as an iron-fortified or soy-based formula. If a mother does not have sufficient human milk, her infant may need supplemental formula. Sometimes a mother may choose not to breastfeed or to breastfeed for a limited time, and in such circumstances, using commercial formula will be necessary. Parents should consult their child's regular doctor about the initial formula choice and before changing formula or changing brands. There are many different types and brands of formula, and generic or store brand formulas may be equally nutritious and less expensive. There are times that it may be necessary to change formulas. As a caregiver, you should observe infants for signs of a feeding intolerance, such as being very fussy or gassy, spitting up a lot, having diarrhea, or vomiting. If an infant seems to have a problem with feeding, alert the child's parent and recommend consulting with the infant's regular doctor. Remember that infants should not have regular cow's milk until they are 1 year of age. Infants should be fed the same type and brand of formula at home and at child care. Formula provided by the parents should be brought in prepared, labeled bottles. If parents use powdered formula, it must be mixed at home and brought in prepared, labeled bottles. Caregivers should not mix powdered formula due to sanitation and dilution concerns. Parents may provide ready-to-feed or concentrated formula in the factory-sealed container labeled with the child's full name. The formula should be poured into clean, sanitized bottles, also labeled with the child's full name. Water for formula dilution must be from a source approved by the health department. To prepare a bottle, first, wash your hands. Be sure to use clean and sanitized bottles and nipples. Rinse and dry the unopened formula can. Then fill the bottles with enough formula for 1 feeding. Cover and refrigerate the unused portion. Use the open container of formula within 48 hours. Bottle sanitation is similar for both human milk and formula. Each bottle should contain human milk or formula for a single feeding. For young infants, consider using 4-ounce bottles rather than 8-ounce bottles. Encourage parents to transport bottles in insulated, cooled bags, especially those with a freezer pack. Upon arrival at the child care program, bottles should be immediately stored in the refrigerator at a temperature of 39 degrees Fahrenheit or 4 degrees Celsius. It is recommended that a separate refrigerator be used for infant bottles, infant food, and other infant supplies. If a refrigerator is also used for other food storage, then place bottles near the back of the refrigerator on a designated top shelf to avoid contamination by food spillage or drips. A bottle should be in the refrigerator until the infant is fed. Bottles should never be left at room temperature. Complete the infant's feeding within 1 hour. After that time, harmful bacteria can grow. Discard any remaining formula or human milk after the feeding time has elapsed. Return all bottles to the parent at the end of the day. If the program provides formula and prepares the bottles and nipples should be cleaned and sanitized by 1, washing in an automatic dishwasher, or 2, washing in hot soapy water, then rinsing and boiling for 1 minute. Be sure the hole in the nipple is cleaned thoroughly. It is very important to follow procedures to ensure that the appropriate human milk or formula is given to the infant, or in other words, the right bottle is given to the right infant. To avoid mistakes, be sure to feed only 1 infant at a time, handle only 1 bottle at a time, confirm the identity of the infant, and check the bottle label twice for the infant's name. If human milk is given to the wrong infant, caregivers should follow the Caring for Our Children Standard 4.3.1.4, feeding human milk to another mother's child. The parent of the child who received another mother's human milk should be contacted if this happens. The caregiver should recommend that the parent contact the child's regular doctor. Such an occurrence should be documented in an incident report. Bottles can be served at a cold temperature. However, infants who are normally breastfed may be more willing to accept a bottle if it is warmed. To warm refrigerated bottles, place the bottle in a container of warm water for 5 minutes or less. The water should be no more than 120 degrees Fahrenheit. If an electric slow cooking device or bottle warmer is used to warm bottles, the device should contain water that does not exceed 120 degrees Fahrenheit. The device and electrical cords must be out of children's reach and positioned away from children's areas. The device must be emptied, cleaned, sanitized, and refilled with fresh water each day. After warming, remove the bottle from the water. Dry thoroughly with a disposable towel to prevent the risk of hot water dripping onto the infant. Gently swirl or mix the bottle after heating to evenly distribute the warm milk and prevent hot spots. Do not shake the bottle. Check the temperature by gently shaking a few drops out onto the back of your hand, which is more sensitive than your wrist. It should feel cool or slightly warm. An infant's mouth and skin are very sensitive. Remember that milk that feels warm to you may be too hot for the infant. Do not, under any circumstances, microwave bottles. There are many reported cases of serious burns to infants due to microwave bottles. The bottle may seem cool, but the liquid inside may be extremely hot. Additionally, the buildup of steam in the bottle, which is in a closed container, could cause it to explode. Bottle feeding techniques should mimic breastfeeding. If possible, have the same caregiver feed the infant for every feeding. Be sure to hold the infant during feeding. Caregivers may talk, sing, or croon to infants during feeding. Respond to infant vocalizations with eye contact and return vocalizations. Make sure the bottle is upright and the nipple is full of human milk or formula. This procedure will decrease the amount of air that the infant swallows during the feeding. Allow the infant to stop during the feeding. Watch for signs of fullness. Burp infants after every feeding and during feeding if needed. Feeding should be completed within 1 hour. After 1 hour, harmful bacteria can begin to grow in the human milk or formula. After feeding, be sure to discard any unused milk remaining in the bottle. There are 3 things that you specifically do not want to do during bottle feeding. Do not prop a bottle, do not allow infants to have bottles in the crib, and do not allow older infants to carry a bottle while standing or walking around. Infants should be fed on demand. Most infants will be hungry every 3 to 4 hours. An infant usually needs 3 to 8 ounces of human milk or formula at each feeding, depending on the infant's age. Newborns and breastfed babies may need to be fed smaller amounts, and they may need to be fed more frequently. Observe infants for signs of hunger, such as sucking on the fist, rooting actions, or sucking on a pacifier for a few seconds and then crying. If it has been 2 to 3 hours since the infant was last fed, or if the infant did not consume much at the last feeding and is acting this way, feed the infant. If the infant is finishing a bottle and acting hungry again after a short time, try adding more human milk or formula when preparing bottles for future feedings. Let the infant decide when to stop eating. Watch for fullness cues. The infant may seal his lips together, decrease or stop sucking, turn his head away, or fall asleep. If an infant is sleeping, do not wake him for feeding unless his regular doctor has instructed this for medical reasons. Before you advance to the next slide, take a few minutes to review the handout, Child Care Meal Pattern for Infants. This handout is based on information from the USDA's Child and Adult Care Food Program and is consistent with Alabama's licensing standards for child care programs. Burp the infant after each feeding. When burping an infant, use repeated gentle patting on the infant's back. Try experimenting with different positions that are comfortable for you and the infant, such as the following. You may sit upright and hold the infant facing you against your chest. The infant's chin will rest on your shoulder as you support the infant with one hand. With the other hand, gently pat the infant's back. Or you may hold the infant sitting up, in your lap, or across your knee. Support the infant's chest and head with one hand by cradling the infant's chin in the palm of your hand and resting the heel of your hand on the infant's chest. Use the other hand to pat the infant's back gently. Another way to burp the infant is to lay him on your lap on his belly. Support the infant's head and make sure it's higher than his chest. Gently pat the infant's back. The last method is to lay the infant on your lap. The infant will be on his back with his head on your knees and his feet on your abdomen. Holding his hands, slowly raise him to a sitting position. It is not necessary to pat the infant's back while doing this. You may want to practice these burping positions with a life-size baby doll. If an infant seems fussy while feeding, stop the session, burp him, and then resume feeding. Burp the infant again when the feeding is completed. Infants sometimes seem to choke when taking a bottle. They may cough, spit, or even throw up. However, infants almost always recover without assistance. If an infant appears to choke, take the bottle out of the infant's mouth. Hold the infant upright and leaning slightly forward, supporting the infant's head and neck, and let the infant cough the fluid out. Do not pat the infant on the back or raise his arms. In severe cases, you may use a bulb syringe to remove fluid. However, this procedure is not usually necessary. Parents should consult their child's regular doctor about when to add juice and water to the infant's diet. Water is generally not given until after 12 months of age. Juice may be served in a regular cup to children over 12 months of age. Serve only 100% fruit juice with no added sweeteners. Serve only juice that is pasteurized. Unpasteurized juice may contain bacteria that can cause serious illness. Offer juice at specific meals and snacks as part of the child's regular feeding schedule. Do not offer juice or other sweetened beverages outside of meals or snacks because it may interfere with infants' hunger and mealtime nutrition. The American Academy of Pediatrics recommends limiting juice consumption for children aged 1 to 6 years to 4 to 6 ounces per day, including what is offered at home. Juice is a natural laxative. Remember that too much juice may cause diarrhea. Honey should not be given to infants under 12 months of age because it can contain the spores that cause botulism. If taken into the infant's digestive system, these spores can release a dangerous, deadly toxin. And as previously mentioned, unpasteurized juice may contain bacteria that can cause serious illness. Some parents may want their child to have a pacifier. If pacifiers are used, never coat a pacifier with honey or another sweetener. Some children may be developmentally ready to feed themselves as early as 6 months of age. To transition from a bottle to a cup, use a small, clean cup with no chips or cracks. Using a regular cup promotes self-feeding skills. Sturdy plastic or melamine cups that can be washed and sterilized or sanitized in a dishwasher are recommended. If disposable cups are used, choose sturdy plastic cups that will not easily collapse when the child holds it. Do not use foam cups, such as styrofoam cups. Children may bite off a piece of the foam, causing a choking hazard. Sippy cups are not recommended for child care. Infants drink from them as they would drink from a bottle and are not learning a new skill. Decisions about the introduction of solid foods are made by parents with guidance from their regular doctor. Gradual introduction of iron-fortified foods can supplement the infant's diet of human milk or formula. Solid foods may be introduced when the infant is at least 4 months of age and preferably over 6 months of age. The first solid foods should be single-ingredient foods. The same foods should be introduced at home and at child care. Document when foods are introduced. Wait 2 to 7 days before introducing another new food. Document any observed signs of food allergy or food intolerance. Be sure to communicate any concerns to the infant's parent. Parents may want to prepare infant foods at home and bring them to the child care program. These foods may be brought in single-serve dishes or in storage containers. If, however, the child care program provides the infant's foods, then the first solid foods offered to infants should be commercially prepared infant foods without added sugar, fat, or salt. Caregivers should not prepare infant foods such as pureed fruits or vegetables on site. Regardless of whether the food is brought from home or commercially prepared, the food should be served to the infant using a feeding dish and spoon. Wash the infant food container with soap and water before opening. After opening, check the rim of a glass container for chips or cracks. Do not feed from the container. Use a clean spoon to place a portion of the infant food on a clean dish. Examine food for glass pieces or foreign objects. Immediately cover and refrigerate the unused portion. Discard unused portions after 24 hours. Feed only one infant at a time. Use a small, soft-tipped spoon that fits into the infant's mouth and serve tiny amounts. Allow the cereal or other food to flow off the spoon into the mouth. This is a new experience for infants. They may spit out the first few bites. Gradually progress to serving foods with more texture. These foods may be commercially prepared or may include soft, cooked, and mashed table foods. At 10 to 12 months of age, begin letting the infant feed himself finger foods. This stage of development, although messy, is a developmental milestone for the infant. In order to prevent choking on foods, do not mix cereal in a bottle. Mix cereal with human milk or formula in a dish and serve with a spoon. Mash or puree solid foods. Foods for infants should be 1/4 inch or smaller in size. Use an infant spoon and give tiny bites. Supervise older infants learning to feed themselves at all times. The caregiver should be seated within arm's reach. If there is any respiratory distress, be sure to call 911. Infants with special health care needs may have individual requirements related to diet and swallowing. Food, eating style, food utensils, and equipment, including furniture, may have to be adapted to meet the developmental and physical needs of individual children. These situations require individual planning prior to the child's entry into the program. Caregivers must be trained in procedures to follow if a child has an emergency, such as choking. Remember, promoting healthy eating in early childhood forms the basis for a lifetime of healthy eating. Please take a few minutes to review the handout, Additional Resources for Feeding Infants and Toddlers in Early Childhood Settings. This handout provides federal resources that are excellent sources for more information about feeding infants and toddlers. Thank you for your participation in this training session. In order to finish Module 1, be sure to complete the second session on feeding toddlers. The training module team may follow up with you in 3 months to see how you have used this information. A short post-training survey may be sent to you at the email address you provided during registration.